Welcome to WWDMD, a podcast that is all about peeling back the curtain on what clinicians really think and feel as they work with others. My guests, clinicians, who are also sometimes clients themselves, risk their vulnerability as they publicly share their emotional reactions to their clients, disclose their challenges in doing the work, and reveal their personal backgrounds. I'm Dr. Meyers. I'm a psychotherapist in New York City with 30 years of practice experience, specializing in anxiety and depressive disorders, as well as sibling relationships and family systems. I'm also a professor of social work at Molloy University on Long Island. I see this as a journey of self-reflection for not only our guests, but you, because with each episode, I'm hopeful that you will learn something new about yourself. Please note that any discussion of case details have been modified to protect the privacy of our clients.
What would Dr. Meyers do?
Hey everyone, I'm back with Dr. Ray Blanchard. Why? Because he was so insightful about teaching us about group dynamics, and now he's going to tell us about systems work and what that means. And I think that that's so relevant to all of us who do this work, but also anybody who's just making their way through life. Because I think that one of the things that we tend to do is to pathologize the individual. And this is kind of a way of looking at how we operate through a broader lens, viewing people as part of a larger system, whether that's family, environment, culture, society. We don't operate in a silo. We bring so much more to everything that we encounter. And sometimes those are external factors, but sometimes they are also internal factors that are impacted by things that we don't easily recognize, I think, for ourselves, or that as clinicians, we do need to take into account context. So important. So welcome back, Ray. And just to give you a brief on him, Ray is an assistant professor and clinical coordinator in Molloy University's clinical mental health counseling program. He's also a bilingual clinician and supervisor with 10 years of experience working with children and adolescents in New York City schools. And if you want to learn more about him, there will be a bio in the description. But hey, Ray, good to have you. He's also my colleague at Molloy University, not in the social work program, but in the clinical mental health program. And hey.
Hey, how are you? It's great to see you.
And you. So get us started. What's the starting point in thinking about how folks operate with a larger kind of scene behind them, larger context?
Yeah, Amy, I love the opener that you did, right? Because I can't help but think around just why systems work really matters in the work we do as social workers, as counselors, marriage and family therapists, and so on. Something that I really think around is this idea and this notion that systems shape experiences, right?
Go down.
And, when we look at it from that lens, we're not just looking at the problem, right? But we're looking at all of the influences, all of the context. We're looking at how, the relationships, the environment, the social structures, the familiar structures, all that plays a role in who we are, right? And so, when we look at it from that context, we're then able to break it down even smaller into things like how family, how culture, how societal influences all shape our thoughts, our behaviors, and our overall well-being, right? I think around a lot of the work that I've done with clients over the years, and yes, you have your structured intake and you ask these questions of, what's bringing them in, but that's just one facet of the bigger picture, right? And so that's where then when we start to break it down into who are the supports, who are the resources, um, who are the networks that they're involved in, it gives us a bigger picture of then how we can best help them from a holistic perspective.
Yeah, so I think about it in terms of transference as well, right? Like this idea of how do we become who we are, why we do the things that we do, why we feel the way we do, why we act the way we do, right? And this is all influenced by external interactions and ways of being related to that we take in and we make our own, and then we move through the world kind of projecting those experiences and expecting others to relate to us in that same way. Now I'm getting a little bit more psychodynamic on you because which is different than a systems perspective, but it all kind of intertwines because from what I just presented, it means that we're carrying all of those other forces, all of those other systems within us, right? In terms of how we operate. So whether that's family, as you said, or environment. What's environment? Mentors, teachers, extracurricular activities, peers, all these things that shape who we are. So I want to hear about it more since they are kind of similar concepts, but from a systems lens in regard to what that looks like. You know, you mentioned supports and resources, and say more.
Yeah. So, if I may, I'd like to introduce, the idea of Bronfenbrenner's ecological systems theory. It's one that I feel is not only taught in a lot of different, mental health and social work courses, but I think the theory as a whole is a really great foundation for how we can view our clients, right? And view the individuals and the families that we work with. And so I first think around the first system, which is our microsystem, right? And that's our direct environment, how our client interacts with their family, with their peers, maybe their intimate partners, but also too their jobs, school, community engagements, right? Maybe they're on a sports team, things like that. And, when we think around, how we as clinicians can really support our clients from a microsystems level, we're able to look at how can we explore those patterns, the communication styles, what are the relational dynamics? Because perhaps the relationships that they have in their family unit carries into the relationships that they have intimately, right? Or maybe the relationships that they have with their classmates, their colleagues. How do they build those connections, share information, things like that. And also too, how does that impact identity development? Because all of those microsystems um, have an influence on, okay, here's how I know I can ask for help. Here's how I can self-soothe or cope when I'm stressed, different things like that. Or also too, how do I navigate expectations?
Right.
So the microsystem is like the first system when I think from Bronfenbrenner's theory that gives us that like smaller picture of a lot of pictures all at once. Does that
Yeah.
make sense?
Yes, it makes sense to me.
Yeah.
So it's interesting because one of the things I'm thinking about as you're speaking is that social work, right, where I come from,
Yeah.
is focusing on the person in a greater context.
Mhm.
And you're describing that, but you come from clinical mental health, which is closely related to psychology. So tell me how you're bridging the two.
Yeah. Well, and that's what I think is great about I think both our fields, right? I think I'm a little biased for us, right, as social workers and mental health, but
Yeah.
um, you know, from a Bronfenbrenner's lens, because Bronfenbrenner I feel like is infused in our developmental theories courses, it's infused in our crisis courses, and just how we look at systems as a whole that our clients are involved in. And so from the microsystem, we can then elevate it out to the macro system, where I often know especially when I'm connecting and talking with, my social work colleagues, of looking at those macro system levels of influence and dynamics, power, right? So maybe we're looking at cultural norms, maybe we're looking at systemic racism, heteronormativity. How is the current political climate influencing, access to resources, funding sources, all those pieces. And so I think whereas we just talked about the microsystem and we bridge it out to the macro system, and I'll touch base on the two systems in between, but from a macro systems level, I think that's where then for us, from a systems perspective, we can do that social justice and advocacy work, right, for our clients, thinking around how do we connect them to those resources. Um, what is the historical context, right, of both their needs, but also within the needs of the larger society, right? Has that always been an issue within the community that they don't have access to proper mental health services, right? And they have to travel far for it. Or do they have the resources to And I was just talking about this last night in my ethics course because we were talking about telehealth services and access and things like that. But what are the proper resources available for folks that have internet access to then allow them to do telehealth?
Hmm.
Is it that they have to do it from a phone, or do they have access to some sort of, computer, iPad, different things like that? And so from that macro system level, we're able to then think, okay, here's what they need in order to then influence the microsystem,
Hmm.
right? Um, because, and I'll kind of connect this too, is, the idea of the mesosystem there, where it's like that interaction between and across different microsystems, right? So when we get to know our clients and maybe how the client interacts with their family and, the family with the intimate partner, right? Those are interactions between all three of those systems. And you can think around, okay, what does collaboration look like? What does engagement look like? Um, what is communication, and how does that, impact the dynamics of the relationship, different things like that. And so as you talk about this with clients, um, you really get a nice sense of from who they are as a holistic being, right, from that macro level all the way down to how do those smaller microsystems interact with each other.
Yeah.
Yeah.
Yeah, I love that we're speaking the same language. I never knew we spoke the same language so closely. It's really closely aligned.
Mhm.
So, give us an example, can you, of somebody that you're working with who comes in with an issue that seems like it's affecting them, that they're struggling with internally, but then you have the realization, or you're able to move from compartmentalizing it to something that's pathological to something that's, right, more broadly contextualized.
Yeah, absolutely. So, I can kind of give two examples. I'll give one child, one adult, if that's okay.
Yeah, that's great.
When we're thinking about, let's first start with an example of a child. From a microsystem level, let's say you have your kiddo who comes in who is struggling with self-identity, these having higher expectations of themselves because of the pressure that's put on by family, pressure that's put on by teachers, and then ultimately too what the pressure is that they're putting on themselves, right? And so they're presenting with a lot of anxiety, and they're thinking of, if I don't get that 100, I'm not successful, right? And I think of particularly a kiddo
It's half of
that,
my classroom. Go ahead.
right, same.
Go ahead.
And I think around a kiddo that I'm working with recently, 11 years old, very smart kid. And with the amount of pressure that he also puts on himself, he is also having difficulties with his social, like, friendships, right? His peer relationships, things like that. And so, whereas he wants to get involved with classmates or maybe do some after school activities, he's also thinking, I need to study and make sure I get that 100, right? So, from the microsystem level, we're thinking of, here's how he's interacting with parents, here's how he's interacting with teachers, here's how he's interacting with his peers, and how does that also mean for who he is, right? The goals he has, things like that. He's a brilliant kid. Um, so much so that in one of our sessions, he said, I'd really like to make an ethical decision here. So can you help me with that? And I remember being like just so taken aback. I was like, tell me what that means to you. I
Right,
have, I'm like, I haven't heard an 11-year-old say, help me with an ethical decision.
right,
And
right.
he was able to very eloquently explain it. And I was so impressed, right? So
Yeah.
that gives like a nice picture of who he is as a kiddo and a person. Um, but as we started to think about it, especially when I think working with kids and from a systems lens, it's not just working with the kid individually, right? You are working with the parents. If you're able to, depending on the setting, working with the teachers, maybe working with other folks in the schools. And I hold that identity as a school-based clinician. But this kiddo I actually see virtually in my practice. So my engagement with the school is very limited, just because it depends on if they respond. But at least the opportunity is there, right? So you want to think around how do you engage in that lens.
Okay, so on one hand, you're talking about collaboration, right? And collaterals. And so the parents are collaterals that you can work with because you see the kid 1 hour a week, right? And the parents are with the kid all that other time. So they're necessary components of this puzzle and helping them understand who their child is and what his needs are, right? And then of course, ideally, if you could work with the school or have some collaborative phone calls, that would be great. I
Right.
want to come at it from the other end, though, in
Sure.
terms of understanding, just in terms of assessment, understanding how this kid is being impacted by these external forces that are influencing his identity and his self-perception, his self-expectations of what's important and where all his focus lies. And obviously, there are other things in his environment that are creating this. He wasn't just born like this, right? So,
Correct. Right.
so take me there if you can a bit.
Yeah, absolutely. And so from an assessment lens, right, when we're using a systems approach, so I also ascribe to a cognitive behavioral approach. I think it works really well with kiddos. There's something about the tangible skills that they can learn, and also just the way of like processing how their thoughts, feelings, and behaviors all interact. And I break it down small, right? So I'll say, let's talk about family. Tell me who's in the family, who makes it up, how do you interact with them, things like that. And so as you get to explore some of those relationships there, then you're able to explore, okay, tell me what it's like to work, or to spend time with your brothers or your sisters, right? You're doing some of that relational assessment there.
Of
And then it's tell me about mom and dad or guardian. In this case, my kiddo has both parents living at home. And
course, I
so,
have to pause and say, I love that you say kiddo. I mean, it's like all of your kids that you see are kiddos, right?
all of them. Sometimes
Oh,
I call my adult students the kiddos too on accident.
okay. All right. And what I keep hearing. Well, one, you said CBT, and I don't hear that piece yet. Maybe you're getting to it. But
Yeah.
what I do hear is a psychodynamic framework, which is like, is it really so separate from systems thinking?
Now that we kind of say this out loud, I could definitely see the strong connection there. I don't often think of, personally, at least I think from a psychodynamic lens, but I think it is interesting that we point this out as we're dialoguing about it,
Yeah,
because I can
yeah.
absolutely see that connection there.
Yeah. Well, I didn't mean to interrupt you, but it's kind of interesting because you're talking about a case in very much the way that I would. And I don't consider myself a systems theorist or therapist, but I'm a psychodynamic therapist. But we're really using, again, the same exact framework in terms of thinking about somebody beyond what they present or who they are as an individual. So it's kind of curious, but.
Yeah, no,
How,
you make a good point. Because I do think that all that's at play, right? The relationships, the thoughts, the feelings, the connection between it. I know in the last podcast, we had talked about like the cognitive triangle, right?
Mhm.
How our thoughts, feelings, and behaviors all interact. And that's where I spend a lot of time, especially in that assessment phase of a microsystems lens, because I'll say, hey, let's put family in the middle. What are our thoughts when it comes to family, right? How do we feel when we're interacting with certain folks? How do we behaviorally or respond to other individuals, right? And, kind of paint it in that framework, as a way of thinking about, hey, I realize when, my brothers come into the room, they annoy me. So I feel annoyed. And here's how, I try to go sit in my room by myself or things like that, and you kind of explore a little bit of the relationships that way. Um, so that's where I pull in a lot of like the CBT approach is just what are the thoughts and feelings that are connecting there. Um, and that's part of the assessment, right? Because then as they're talking about, mom and dad put a lot of pressure on me to be a really good student. Well, what does that mean to be a good student? Tell me,
Mm,
tell me how have you heard that from mom and dad? How do you like internalize that?
mhm,
Um, and things like that. And so, from that microsystems approach, you're then able to say, okay, here's the relationship patterns there. Here's the stress that is caused, and also, two, what are the communication styles around it, right?
mhm, mhm.
maybe the use of I statements, different things like that.
Right. It's an integrative approach. I love it because that's what's needed. We are complex beings, and there's so many elements of who we are and how we operate. And you got to be able to think, I think, the way that you're thinking. Okay, so
Yeah.
sorry. Get back to the systems piece.
No, it's great. It's
Right.
great. Yeah. No, and I tell my students that all the time, or clinicians that I've worked with over the years, is yes, you may say I use a CBT approach, but what does that mean?
Yeah.
How does it apply to your clients, right? And so I'll try to infuse either a systems lens or infuse a multicultural approach, right? Or an identity, right? Developmental theory, things like that, because it's more than just CBT, person-centered, dialectical behavior therapy, but how can we pull from a lot of these frameworks to create that holistic picture of a client,
Yes.
you know?
Exactly. Yes.
Because we're often missing, and I think especially when we're thinking about from a social justice and advocacy lens, and I'll connect this, to the macro system level, is when we're not incorporating all aspects of their identities, right?
Yes.
We're missing out on who they are.
Yes.
We're not
Yes.
able to
Agreed.
say, here's their traditions, values, and beliefs, and how that influences that idea of being the best student, right?
Yes. So
You
where
know,
does this come from for this kid?
so for him,
His expectations, his high functioning, the pressure he puts on himself.
yeah, it's coupled with, parental influences, right? Of just saying, we really want you to do really well, but also the school has really high expectations as well. And that I've seen, happen in just my time working in schools is, the expectations that teachers have on students, and it makes sense, right?
Hmm.
We want our students to do well, but also taking into consideration, and I think that's where I'll tie in the mesosystem and perhaps even like the exosystem, right? I haven't mentioned the exosystem yet, but that's really where like, policies, caregiver stress, system influences both, indirectly influence a person, right? And, let's say the school has really high policies and high regard for hitting certain grades, making sure a certain number of students pass, right? Because of those expectations set, it trickles down to the teacher, which then trickles down to the student. But maybe not all students learn the same, comprehend the information the same way, take the test in the same way, different things like that. And so, how can we also modify as needed?
But
Right.
also in terms of policies and politics, why does the administration have these expectations? Is because maybe it's tied to funding or who knows what in terms of the expectation that they have a certain percentage of student population who, receives high grades so that they can continue to provide scholarships or whatever it is. It becomes such a complicated piece of, systems that we don't really, we just have to work within, I think, to a certain point, right? Unless we're moving towards our role of advocacy. But when you're doing private practice like you are, I mean, that's where kind of the line is drawn a bit, but it's still important. You're not going to go out and advocate for this kid and the administration and the way that the school functions, but you're going to help the kid to operate within the system that is already in place, that he is a part of and can't necessarily influence at this point in his life.
Correct. Yeah. And I think that was very well said, because when we think around the politics at play, the policies at play, you know, what is my role as the clinician, right? And so for this kiddo in particular, when we think around the school expectations, it's thinking of what support has he sought out in the school before, right? Do they have a school counselor, a school mental health counselor? Is there extra allotted time, study halls, things like that? And then you work with the child and the family on advocating and saying, hey, I think my child maybe needs an evaluation, right, just to make sure that where he's at academically is appropriate, right? And so then it's working with the family to then advocate, not so much me directly advocating.
Hmm.
Now, if this was me working in the school like I once was, oh, absolutely, I'd be at the school social worker's office, certainly with parent consent and things like that, um, to say, hey, so and so's having some really difficult times in class, a lot of class pressure. How could we work together to best support? Like, what's going on in class that you observe, right? And that brings it back to the assessment piece that we were talking about before. Because if you're able to gather information from the school, from the teacher, different elements like that, then that also helps create a more holistic picture to then say, okay, here's how he's interacting at home and the observations and feedback there. Here's how he is in school, observations and feedback. Now, how does that tie into the treatment plan and ultimately the interventions that we're going to use
Yeah.
um, as clinicians?
Yeah. Yeah. Well explained.
Yeah.
Let's see an example of an adult, as you said, that you were going to bring on
Yeah.
too. Yeah.
Yeah,
Very
no,
cool.
that's a great one.
I love
Um,
I love learning by example. I think it helps to apply to the concepts. Go ahead.
Totally. When I think around examples with adults, I can't help but think about a former client that I worked with who, um, it was really a privilege to work with her, because, she was an individual, again, saw her in private practice, and it was her first time in therapy. So right there, I'm thinking from a systems lens, and I'm thinking from that macro or even like change over time, right? The chrono system perspective of what it took for her to finally come into therapy. You know,
Mm-hmm.
32-year-old African American female, who identifies as a lesbian, and that's what she was coming to services for, was to explore her identity, what that meant in the context of her family, what that meant in the context of her past relationships, because she
Mm-hmm.
had recently broke up with a partner, things like that, and really thinking about, the marginalization as a Black queer woman.
Mm-hmm. Mm-hmm.
Um,
Two
and
oppressed identities. Yes.
and then some, right? Because she
Three.
talked.
She's a woman. Three.
Right,
Yes.
right. When we think around the intersectionality,
Mm-hmm.
different things like that, it, and the reason why I say it was such a privilege to work with her because, we worked together for better part of a year. And just to see that change over time for her, because we got into systemic barriers, we got into self-advocacy for herself. We talked about the familial relationships that she had and how some did accept her identity and how some did not. And what did that mean for her own identity, knowing that, she has a conflict, within the family units?
Mm-hmm.
What did that mean for going home for the holidays? Different things like that.
Mm-hmm.
And ultimately, when we look at it from a microsystems lens,
Mm-hmm.
and I would also say, a mesosystem, we're also thinking of her relationships that she had and the most recent one that had ended.
Mm-hmm.
What were the similarities and differences there?
Mm-hmm.
And it was so powerful to see her advocate for herself. It was powerful for her to challenge her anxiety that she had
Mm-hmm.
related to relationships with her family, relationships with the past partners,
Mm-hmm.
um, and also to how she started to put herself out there, not so much necessarily in the sense of dating, but she had talked with me around how she wanted to connect more with the queer community in the
Mm-hmm.
community that she lived in. Just
Mm-hmm.
for confidentiality purposes, I won't say the
Of
specific town.
course. Of
Um,
course.
but knowing the town she lived in, we were able to find three LGBTQ centers that were in the community. And from there, she joined a queer bowling league. She had started to go out more, whereas before she had turned more inward. And
Mm-hmm.
so when we look at this from a systems lens, we were able to assess, and this one I think, kind of going back to what we were saying before around like developmental theories or different identity developments and things like that. That's where for us as clinicians, pulling in from all these different models is really helpful. Because, she was saying to me, Ray, I've been out for, I think at that point it had been maybe like 5 or 6 years. But she was like, I still don't know what it means to be a queer Black woman.
Mm.
And we also talked about the fact, just what did it mean to be a Black woman in her community, and
Mm-hmm.
also the dynamics with her and I, right? Because she's like, you're a white male, I'm a Black queer female, and the dynamics and the relationships at play, and it was just so, it's one client that I think about the engagement and her growth over time because it was just one of those clients you worked with that was seamless, if that makes sense. We always talk about in teaching how you might have your challenging clients, but she was one where she came to session every week and she said, "Here's the homework that you gave me last week. I did, I
Uh-huh.
tried to go out and I tried to
She
do
was that, I'm putting it in quotes, that good client who, right, did her homework, who had
exactly
insight, who really, it sounds like also could communicate well what her needs were, what her feelings were. I mean, yeah, those are prizes, right? Those are gifts. So when you say that it was a luxury, to work with her, it makes sense. Plus, the learning curve for you, I'm sure, right, in terms of not being in a female body, not being in a Black body,
right,
and contending with what these cultural aspects are from race and her cultural standards and expectations. So again, that's another way of thinking about systems, right? So with your kiddo, you're talking about the school system and the family system. And here, of course, it's implied that there's a family system that has shaped the way that she views herself and her multiple or this particular queer identity. And I'm thinking about, in the African American world, how that is generally perceived and received. And then on top of that, I don't know as well, of course, the neighborhood that you're referencing, but we can imagine, right, that if it's a white neighborhood or predominantly straight neighborhood or a neighborhood with resources versus not having resources or all the various variables that impact how she's navigating this identity, that I think that, like me as a white heterosexual middle class woman, does not have to contend with. And so, it makes me think about, right, I would want to consider, well, what systems do I have to contend with, and in what way? And in what way does that impact me directly? And what way does that distinguish me from what other people have to experience? So,
right.
yeah, the impact of the systems, right, on so many different levels that we've kind of hit through looking at your kiddo and looking at this young adult,
Mhm.
um,
Yeah.
is very, very interesting. Go ahead.
And also too, like one comment there as you were talking, it makes me think around how we bring that into the counseling session, right? Whether it's a child or it's an adult, how do we invite that in? Because with the kiddo, doing the work with him was, all right, how was it this week in the cafeteria trying to engage with your classmates? What came up there, right? And then you're exploring across like the systems. All right, what happened? What didn't happen? Then maybe you're pulling in the triangle. Maybe you're doing some problem solving of, all right, maybe what if we said it this way? What would that be like to do it that way, right? So that's with our kiddo, is how you bring that into the session to explore. And then similarly for the adult, thinking around, okay, you went to the LGBTQ center this past week. What did you observe? How welcoming was it? What activities did you get involved in? Again, with this client in particular, like you said, the model client, the good client, by the time we terminated, she was joining and going to serve as like a volunteer for one of the queer organizations. And, just to think from her growth, like from coming in and
Mhm.
like that, it really just shows how working in, challenging in those systems and how you like process it can really have a big impact.
Yes, but I'm also thinking about, again, the overlay between what you said about the impact of how somebody is moving within these systems. Like you said, the kid, what's his interaction like with his peers? What's his school experience like? And then with the adult, you mentioned patterns of how she is interacting, I think also with intimate partners, right? And
Right.
so it's so interesting about what we can learn from those patterns, because one, we're getting to the lived experience, right? What is your lived experience of moving through life, and navigating the challenges that you're having? But when we think about patterns, we're also sometimes looking at, what are we as individuals bringing to the situation, that we are creating patterns, right? So that if somebody is attaching themselves to intimate partners that kind of have some similar characteristics, what's happening, what are you bringing to it? But at the same time, being involved in these different systems, whether it's school, family, or relationships, how is that impacting you, so that it's like a bi-directional exploration of the impact of us on others that impact ourselves, and the impact of others, and thinking from a systemic lens, and systems on us, and how we move through, and how that creates who we are, and how we think, and how we feel.
Right. Yes. And it kind of, as you were talking, it brings me back to the thought you made before with psychodynamic, right?
Hmm.
How there's a lot of similarities or some crossovers.
Hmm.
And what's the term? Like the unconscious processes that
Hmm.
folks like engage in, it's like what is coming up from those past engagements that maybe you're not fully aware of, right? But it's rooted in that those past experiences, maybe the feelings, the desires, the patterns, and how that is showing up present day, right? So I
Exactly.
think actually now that I think about it more, it's so closely aligned in so many ways.
Right? Yeah. Yeah. I think when we tend to think of systems work, though, we do tend to think about more operating outside of the clinical space, and thinking about how we can impact, interact, advocate, and do all those things for our clients, that maybe is a little bit more social worky. Um, Only social worky if you're not doing direct clinical work, because the direct clinical work is helping your clients navigate those systems, understanding how they're impacted by them, but helping the client navigate them, right? As opposed to other forms of social work where you would be out there, trying to make the changes,
Right.
right?
All the
Yeah,
different influences that folks can do and have, and
yeah,
yeah, without
yeah. Well, I'm glad we came full circle, because it kind of felt like an exercise in trying to distill that even for myself, right? So
Yeah, no, I
uh,
love it
that's
because,
the cool part of having these conversations.
yeah, without a doubt, I couldn't agree more. And it just has me think too, just like some other thoughts that come up is just like strategies that we can use that I think from a systems lens that can really help us understand our clients well, right? So kind of thinking about the kiddo that we talked about, or maybe the adult is thinking again, we talked about collaboration today. We talked about like cultural influences and things like that. But I also think around, the role of things like genograms, right?
Hmm.
And how that can help us understand our clients from a systems perspective. Um,
Well, isn't that, now I'm going to question that. Isn't that eco mapping? Because genograms is the family patterns, right? The influence of family, and looking for those connections. Whereas my understanding of the eco map is more, yes, definitely systems, school, even transportation, to welfare, to medical services, health insurance, all of these things, right? That impact our ability to function to our highest capacity.
I think you can use one or both, right? Either or both, right? In some ways. I think eco mapping, absolutely. It's brilliant because you just mentioned all those different, pieces and facets of an eco map, absolutely. And I think too with genograms can help with the family relationships and dynamics that maybe at that microsystem level, you're able to say like, okay, who's all involved? And
Hmm.
then how do we also then, get more of that context from there?
Yes, yes. I love
Yeah.
context. Context is just like, to me, that summarizes the whole thing.
Oh,
We
for sure.
can't negate or ignore the impact of our broader society, and resources that are available or not available, or that we need to tap into, and our political system, and our cultural system, and our multiple identities, and how that influences. I mean, I feel like we're sounding to sound like a broken record, but how that shapes, who we are and how we move through the world. How do you just kind of keep that out of the picture, right? You have to look at it. And so I hope that that sums up what we're talking about today.
It sure does.
Consider big picture. That's all. We're bigger than ourselves. Do you want to summarize that in your voice?
Yeah, I mean, I think that that's a really brilliant way of closing it is, when I think around all that we've talked about today, it makes me think around how, systems or like thinking in systems helps us with empathy building, right? thinking about more accurate formulations, right? When we think around like diagnosing, do we
Yeah.
have the full picture, right?
Yes.
Like what is
The
anxiety?
problem, right? It's like, right? That we're looking for the problem within you. No, right? Not
Exactly.
always, right?
Right. Like what are those like system influences that are also affecting it, right? So if we
Hmm.
say anxiety, if we say depression, even if we say suicide ideation, what are the triggers, right? Because once we get to know the triggers, then that tells us about those other systems that we have to explore, you
Hmm.
know? So I just think it allows for more accurate formulations. And then also too, kind of going back to what you said, I think it's really just about that idea of helping people in the context of their world,
Hmm.
right? Not us assuming, not us, just saying, okay, check the box, great, this happens here, this happens there. But how do we get that real life picture? Because life is complex. If anything that folks take away from our conversation today, I think around how relationships, culture, community, self-identity all plays a part in that complexity. And how do we understand it? And then
Wow.
also too, how do our clients understand that in and of themselves?
Yes.
Because then I think that's where the real work happens and how they can grow and work towards those goals, however they set it in therapy.
Well said, well summarized. I hope folks get that messaging, right? Whether you're an individual who blames yourself too much, right? Or a therapist or social worker or clinical mental health counselor who needs to kind of think broadly. Ray, thank you so much, Dr.
Thank you so much, Amy,
Blanchard. Yeah,
for having
and
me. Wonderful.
thank you. It was. Thanks so much. All right, talk soon.
Talk soon.
Thanks for listening. I really do appreciate it. If you like what you heard, please consider leaving a rating and review on your podcast platform. And don't forget to subscribe so you don't miss my next episode. If you're struggling with clients, I'm happy to consult or provide supervision. Consultations are also available for any person listening. If you're struggling with sibling abuse, you may want to join my sibling abuse workshops. I'm open to feedback on topics you'd like to hear or questions, so feel free to email me at drmeyerspod@gmail.com. You may be interested as well in checking out my blogs on my website at amymyersphd.org.
I've got some problems, yeah, I've got some questions. I need some help, point me in any direction. Clinical guidance is what I need to help me become who I'm meant to be. I've been searching for a teacher, another point of view. And I've been asking myself, what would Dr. Meyers do?